This is the eHealth Radio Network, your source for health advice on demand. And now your host, Eric Michaels.
Thanks for joining us once again here on the eHealth Radio Network. This is your host, Eric Michaels. eHealth Radio gives you the most current health information, news, and advice featuring some of the leading innovators in healthcare and wellness who are changing healthcare as we know it. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. Today we're speaking with Mr. Daniel Zakowski, the CEO and co-founder at Ready Set Food, an innovative company that is working to help prevent babies from developing severe food allergies. Daniel even was on the hit show Shark Tank when he got investor Mark Cuban to join the RSF team, and you gotta love that. And Daniel, thanks for joining us here today on eHealth Radio.
Thank you very much for having me on to talk about Ready Set Food and how we can help all these babies eat a lifetime of peanut and egg and all these other allergens.
And I'm sure the listeners like the sounds of that. I do as well. Now tell us, how did you actually come up with the Ready Set Food product and concept?
So we developed Ready Set Food after my nephew developed a number of severe food allergies. My brother-in-law is a doctor, and one of our good friends is an allergist. And we were talking about what the science said about food allergies around that time. And it turned out there had just been 3 different randomized controlled trials showing that by feeding babies small amounts of allergenic foods like peanut and egg, starting at around 4 months of age, you could end up preventing between 70 to 80% of those food allergies from developing in the first place. So that if my nephew had been fed those foods earlier and more frequently, it's not certain we could have prevented those food allergies, but the real likelihood is that he would be able to have a life free of these food allergies and be able to have a more normal experience at kids' birthdays and things like that. Where right now, because he's allergic to egg and milk, he really has to be much more secluded and isolated than I think we'd want a kid to be. So we really saw that there was a need for all parents to have an easier way to follow the new medical recommendations for feeding your baby these foods in small amounts at an earlier age. And we developed Ready Set Food to help teach parents about the new science and medical guidelines, but really to make it just easy for them to follow those recommendations and make these allergenic foods a part of their baby's diet from a young age.
Well, certainly do appreciate your being proactive and making this happen and bringing this to market. Congratulations on that. Now, what are the health benefits to kids taking the product daily?
So, the reason that there's these new medical guidelines, for example, the USDA has now issued a report recommending that all babies eat peanut and egg and other allergens like that starting around 4 months of age. Because it's been shown to reduce the risk of developing food allergies. Depending on which clinical trial you're looking at, anywhere between 66 to 80% reduction in the rates of food allergies, among babies that follow the guidelines that are now recommended by the USDA. The problem is, and the reason we made a product, is that most parents really struggle with doing that process. And even in the biggest clinical trial, more than half the parents weren't able to stick to the protocol from the clinical trial because it was just too hard to feed their baby all those different allergens on a regular basis. So, there's one benefit that the parents will get from following the clinical trials, which is, a 70 to 80% reduction in the rates of food allergies. And what our product does with Ready Set Food is just make that process really easy. And that, it is something that parents can do on their own. And we encourage people to just learn about the science and the guidelines behind it. But that Ready Set Food makes it just very easy because all you have to do in order to feed your baby these allergens using our product is to put one little packet of powder in your baby's bottle once a day. And that packet of powder just has real food, just peanut, egg, and milk, but powdered and in the right dose to dissolve properly in your baby's bottle. So it's just easier for them to eat it and follow those guidelines that say you should feed your baby these allergens to reduce their risk of food allergies.
Now, as far as the dosage is concerned, what is the recommended daily dosage?
Great question. So in the clinical trials, they generally found that around 3 grams of allergenic food protein per week is what's recommended. So whether that's like peanut or milk, they generally found about 3 grams of the protein. Now, that means about 6 to 8 grams of the actual food to get that much protein, which, for example, can be like if you've ever seen the baby food called Bomba, it's this like peanut snack that it can be, a handful of these peanut snacks a number of times a week. but then that's just one allergen. So, what our product does that makes it really easy is we have, a powder of all the different allergens in the right dose, getting you to that, 3 grams a week per allergen, and that in a powder that dissolves in your baby's bottle. The one difference that I would call out is with egg white especially, you can do a little bit less based on one of the clinical trials, only about a gram a week of egg white. But generally for all the other allergens, the guidance is about 3 grams a week per protein.
Yeah, thanks for your input and information and insight so far today. We're speaking with Mr. Daniel Zakowski, the CEO and co-founder at Ready Set Food, an innovative company that is working to help prevent babies from developing severe food allergies. He's joined us here today on eHealth Radio's Allergy Information and Health News channels, a part of the eHealth Radio Network. Now, for parents that may be worried about adding this to their infants' bottles, what have been the results so far?
Parents really love it. I think that parents these days are used to adding something or another to their baby's bottle. There's different kinds of vitamin D supplements that some parents have to add, or things to prevent gassiness. And I think from one of the things that we love about our product is it's just real food. There's no chemicals or additives. It's just peanut and egg and milk, organic, non-GMO. So it's just the real food you would feed your baby anyway. So, I think that babies love it because there's not really any taste. It's an easy way for them to get the food that they might struggle to eat otherwise. And parents love it because it's a lot easier than every morning trying to make sure you cook a little bit of scrambled eggs and get a little bit of peanut butter, into a baby that might not be otherwise inclined. And I just remember the first time I started feeding my, I have 3 kids under the age of 7, and the first time I feed my oldest child solids, and I was so excited that I could kind of be in control of the feeding process, and it wasn't going to be something that only my wife could help contribute as much to from the breastfeeding perspective, but that I could really help and be more supportive, and it was just a disaster. And there was food all over the floor and all over the walls. So I think when we think about what's the right way to do it, the right way to do it is any way that will get these peanut and egg and other allergens into your baby is the right way for your baby, but that so many parents struggle with like the difficulty of feeding their baby anyway, and to add one extra difficult thing on top of that can just be a challenge. So, having an opportunity to put in a bottle, which is just something that every baby is eating reliably, makes it so much easier than trying to do it any other way with, peanut butter or scrambled eggs. So, I think that like nothing with a baby is going to be, so simple, but that we really work to make it just part of what parents are doing already, and just not something that will add additional stress or work to their life of already trying to feed their baby other kinds of solids, like broccoli and mashed potatoes, and not have to add one more layer of stress into that with these allergenic foods.
Good stuff, good information, and so convenient what you're offering in these regards. Now, your product is partnering with hospitals and organizations around the U.S. Tell us more about what's to come in those regards.
Yes, I think we're very excited, for about 2 major types of partnerships. One is educational partnerships that we're making with healthcare systems, and the other is donation partnerships to donate our product to families in need. So on the first side, there's a number of different healthcare systems that we've already started partnering with to help develop new educational material for them, because part of the challenge regarding food allergies and introducing these allergens early is that most parents just aren't aware of the new medical guidelines. And they need better education, and that the hospital systems and providers know about the new science, but they don't very frequently update their educational content. So we're working with healthcare systems like, for example, Advocate Aurora in Wisconsin and Illinois, who have about 36,000 babies a year, to help make sure that they have the most up-to-date educational material so that the doctors just have an easier time teaching patients about food allergy prevention. We're also working with other healthcare systems like Children's Hospital of LA and Los Angeles to just really help make sure that educational content that talks about like the importance of following the new USDA guidelines gets to every parent, because there's just such a need for more education to be out there, and it really should be coming from their doctors. So we want to make sure that all doctors have access to the most updated food allergy and early allergy introduction material. And then on the other side, I think we're just extremely excited about our donation program. You mentioned that Mark Cuban is an investor, and one of the ways that we started working together on Shark Tank and immediately afterwards was agreeing to do a donation program where we would donate a version of our product to families who couldn't afford it. So any family on SNAP or Medicaid, it can come to a site that we have now called readysetfood.com/giving-back and claim a free 6-month subscription to our product, because we want to make sure that the families that are the ones that can least afford to get food allergies and buy specialized foods and handle all these doctor visits, that we make sure they have the best access to early allergen introduction and following the medical guidelines about how to best avoid those food allergies. So I think we're really excited to help drive education, just generally speaking, with these healthcare system partnerships, and also to help make sure that we get in touch with the families who really need help and get them access to products like ours that help introduce allergens early.
Again, Mr. Zakowski, really appreciate your visit with us here today on behalf of Ready, Set, Food and what you're doing in the space. As we conclude, any closing thoughts, a takeaway, or a tip, or anything else you'd like to make us aware of or inform us of before we wrap things up here today?
Absolutely. Well, I think the message I'd like to leave everyone with is just one around safety. I have 3 kids under the age of 7, and we all want to do what's best for our child. And one thing that people are really worried about is, that first time they feed their baby allergenic foods. It's important to know that recent research has shown that, under 1 year of age is the safest time to introduce allergens. There's actually never been a fatal allergic reaction to food under the age of 1 in the history of U.S. medical records. So while I don't want my baby to, have hives or potentially vomit, the opportunity to introduce allergens when there isn't going to be a life-threatening reaction and also do the thing that will help reduce their risk of food allergies is why I think it's so important that everyone knows about the new USDA recommendations to introduce allergens. And it's why I really appreciate you having us on the show today to help educate and spread that education.
Well, Daniel, it certainly has been our pleasure and honor to get the word out and be a part of that. And again, we thank you for your time and for what you're doing as well. Where can listeners get all the details online, and how can they best be in touch as well?
Absolutely. So you can find our product at readysetfood.com. And also on Amazon. And we have great education available also on preventallergies.org is a great resource if you want more educational content around the science and guidelines and clinical trials.
And that certainly works in an added resource at that. Again, Mr. Zakowski, all the best, and thanks so much for joining us here today on eHealth Radio. It certainly was our pleasure.
Thank you very much. It's been my pleasure too.
And you're more than welcome anytime. We've been speaking with Mr. Daniel Zakowski, the CEO and co-founder at Ready Set Food, an innovative company that is working to help prevent babies from developing severe food allergies. And for all the details, visit readysetfood.com. And again, this has been your host, Eric Michaels, and we do thank you for your continued support of the eHealth Radio Network. Join us again soon for another episode that will help further expand your knowledge on those things that are important to your health and wellness. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. And as always, we do thank you for tuning in.
Thanks for tuning in to the eHealth Radio Network. For more information or to subscribe to this podcast, visit eHealthRadioNetwork.com.